What if the biggest obstacle to patient satisfaction isn't bad communication? What if your nurses already know exactly what they should be saying, but simply don't have the time to say it? Why do hospitals spend millions measuring patient satisfaction, but spend far less time measuring the obstacles that prevent great patient care? Why is the first response to poor satisfaction scores often another communication class? Find out on this episode of the Earn It Podcast. All right, welcome back, everybody. And again, thank you so much for tuning in to this episode of the Earn It Podcast. Today, I want to talk about something that's been bothering me for a little bit, especially after attending another communication class. Whenever patient satisfaction scores come out, whenever HCAHPS scores dip, whenever administrators begin talking about improving the patient experience, there seems to be a familiar list of solutions. We need better communication, right? Remember, AIDIT. Use keywords at key times, hourly rounding, whiteboards, bedside shift report, smiling more, sit down while talking to patients, making eye contact. Don't misunderstand me. None of these things are bad ideas, and communication definitely does matter. Patients deserve kindness and empathy and compassion. But I think we're asking the wrong questions. Instead of asking, how do we make employees communicate better? Maybe we should first ask, what is preventing great communication in the first place? Now, here is a little thought experiment. Imagine two nurses, both are equally compassionate, both are clinically excellent, both genuinely care about patients. One has 4 patients, the other has 7. Which one is more likely to sit down and answer questions, notice anxiety, teach medications, catch subtle changes, comfort the scared family members, update the whiteboard, respond immediately to the call light? The difference isn't personality or communication skills. It's capacity. We don't have a communication problem, or if we do have a communication problem, it isn't necessarily the root cause. Healthcare really has a time problem. See, communication requires time. Education, listening, reassurance, and building trust, all of those things require time, and there's no shortcut for those things. Every initiative that hospitals implement, like hourly rounding or bedside shift report or teach back, or more discharge education, more documentation, more scripting, more service recovery, every one of those things takes time. Time is the currency of patient satisfaction. One landmark study looked at over 10,000 nurses and more than 230,000 surgical patients across 168 Pennsylvania hospitals. The researchers found that every additional patient added to a nurse's workload increased the odds of burnout by 23%, increased job dissatisfaction by 15%, and increased a patient's odds of dying within 30 days by 7%. I want you to think about that for a second. Not 2 more patients, not 3, 1 additional patient. Yet time is the one thing we never add. Nor can we ever add. Here's what the research suggests. It consistently finds something interesting. Hospitals with healthier nursing work environments tend to have low burnout, high nurse satisfaction, lower turnout, and guess what, folks? Better patient satisfaction. That isn't surprising. A nurse who has the time to be present usually provides a better experience. But here's what catches my attention. When organizations respond to declining patient satisfaction by adding expectations without removing existing work, what they're doing is increasing demand without increasing capacity. Occupational psychologists call this work intensification. Healthcare workers usually describe it differently. They describe it as we're being asked to do more with less. Does this sound familiar to you? What does this look like? Let's say administration wants to improve HCAHPS scores. So they implement hourly rounding and mandatory bedside report, whiteboards, teach back documentation, service recovery, scripting, follow-up documentation, audits. Nothing wrong with any of those, but here's my question. Let me ask you this. What got removed? Right. Here's the question I wish that every executive team would ask. If adding one patient to a nurse's assignment can increase burnout by nearly 1/4, why do we think adding 5 new initiatives comes with no cost? We measure every new expectation. We rarely measure the cumulative burden on workers because every new expectation does consume time. And if nothing disappears, the workload doesn't stay the same. It just grows. Now, I want you to imagine another thought experiment here. Imagine you're carrying 10 grocery bags. Someone hands you another. You say, "My hands are full." They respond with, "Carry it with a better attitude." Did your carrying capacity change? No, of course not. Healthcare often treats communication exactly like that. Instead of reducing the number of bags, we coach people on smiling while carrying them. The hidden cost is something that I don't think we talk about enough. You see, communication isn't just another task. It's usually the first thing sacrificed when workload becomes overwhelming. No nurse skips medication administration. No nurse skips critical assessments. Those have to happen. So what are the things that get squeezed? It's conversations, it's teaching, it's listening, it's reassurance. The very things hospitals measure through patient satisfaction surveys, then we tell employees to communicate better. Now, what if we did the opposite? Imagine this conversation instead. Instead of asking, how do we improve communication? Leadership instead asks, what prevents communication? And nurses answer. Too many interruptions, too much charting, too many admissions, discharges, clicks, phone calls, and too many patients. Now imagine leadership actually fixes one of those. Suddenly, communication improves naturally, not because employees changed, but because the system itself changes. Now, here's my challenge to leaders. If you're a leader or a manager, executive, or even a quality assurance person, here's the question I'd ask before launching the next communication initiative. What are we removing? If you're adding bedside report, what documentation are you eliminating? If you're adding teach back, what redundant charting disappears? If you're adding hourly rounding, what support staff are you providing? If you're asking for more, what burden are you taking away? Here's my point here. This isn't about arguing that communication doesn't matter, because obviously it does. No one would say that it doesn't. It's also not arguing that patient satisfaction shouldn't matter to a certain degree. Obviously, in previous podcast episodes, I have talked about the dangers of elevating patient satisfaction to be the primary goal of a healthcare organization. And again, I've gotten into it little by little, and this is just another little piece of exactly why. Maybe I will do an entire episode on my, crusade against patient satisfaction scores being the number one issue for hospitals. But what I'm arguing here is that communication is not created in a vacuum. The work environment shapes the quality of communication. And like I said previously, empathy, education, listening, connection, all of those things need time. If healthcare organizations want employees to provide extraordinary patient experiences, they have to design jobs that make extraordinary patient experiences possible. See, the main issue that I've seen, and I've recently went through it, is, hey, we want to improve patient satisfaction scores. And a lot of hospitals have done this. What ends up happening is you see a trend that happens when you really look at things. You simultaneously have patient satisfaction scores. If they do go up, some places it will temporarily go up. And it will temporarily go up because everybody's making extra effort to increase those patient satisfaction scores. But these organizations aren't trying to improve patient satisfaction scores by improving the employee experience, because to a lot of people that wouldn't really make sense and it wouldn't be obvious why we would do that. So what happens is those patient satisfaction scores would gradually increase, but employee satisfaction scores, these decrease, because what happens is you have employees that have more things that they're doing and they have the same amount of time, not less time, the same amount of time to do it, which means that they have less time per task. You see, patients don't feel rushed because nurses or techs or x-ray techs or whatever employee inside of a hospital just really doesn't like people. What usually is the case is that employee has a lot of other tasks that they have to perform. It is not negotiable whether these tasks get performed. And in nursing specifically, there are dire consequences for not performing specific tasks. As I previously said, things like medication administration and assessments, doing wound care, even rounding occasionally on patients. If you don't do hourly rounding, you need to be rounding. I mean, you can't seriously go give a morning med pass and not, at 9 a.m. and then the next time you're in that patient's room is at 7 p.m. when you're handing over to the next nurse. That's obviously that doesn't sound good to anybody, regardless of what your communication techniques are at the hospital that you're at. The point is, being recently in an extra communication class for the specific goal of increasing, patient satisfaction scores or the patient experience, there were no mention of any kind of barriers to employees to improve communication, or why isn't communication good right now? There's a large assumption by management that the issue is that the communication isn't being done the correct way. So we need to provide new communication tools. What continuously gets ignored is that the reason why patients don't always have a warm, fuzzy feeling, and why things aren't getting thoroughly explained, or why their nurse is not spending a ton of time with them, is because they're running around doing a bunch of other things. And on top of all of that, they're being asked to do a better job at communication, because what matters right now more than anything is patient satisfaction scores. I am very curious to see what would happen if a hospital looked at their patient satisfaction scores and decided, we have really bad scores, or we like these scores okay, but we really want them to be better. Let's ask our employees what keeps them from making really good connections with people and spending additional time with people in order to kind of make them feel more like a person and less like a number in a system, just to see what happens. I wonder what would happen if we take an employee-first approach. What would happen if, instead of taking patient satisfaction scores and going to look for new communication tools, we instead right away looked at employee satisfaction scores and really paid actual attention to different things that employees are asking for, and then really focus on addressing those issues first and seeing what happens with patient satisfaction from there. Again, thank you so much for listening to this episode of the Earn It Podcast. This podcast is on Spotify, YouTube, and Apple. Depending on where you're listening from, please follow, subscribe, comment, like, and most importantly, share. There's a link to my LinkedIn in the description of this podcast, so feel free to reach out if you have any questions or you'd like to come on and have a discussion. Again, thank you so much for listening. Go out there and earn it today.